This is your pelvis, right side, left side. I want you to shift your weight onto your left foot, pick up your right heel so the knee is bent, and turn that knee in and out. And I want you to pay attention how much you can turn that knee in. This is internal rotation of your right hip joint. So now, you're gonna turn your waist to your right to orient that pelvis more facing to the right. And now pick up your right heel, turn that knee in and out, and see how much range of motion you have now of that internal rotation or the turning in of the knee. And what you'll find is that, actually take this back here. What you'll find is that there'll be more limited range of right hip joint internal rotation when the pelvis is more oriented to the right. So imagine if that was someone's normal, natural, default mode positioning or pattern. That's their posturing. And they like to lift weights, they like to squat, and somebody says, hey, you know, you've got a limited internal rotation of your right hip joint, and let me show you some stretches and some mobilizations to give you more internal rotation. So that's where you start getting into the little danger zone of what you'll be doing is creating more internal rotation at the joint where you're already there, right? So what happens at the pelvis is that the pelvis is already, when it's turned to the right pelvis is more internally rotated, which orientates the hip joint more forward a little bit, and it's already in an internal rotated position. So if you do more mobilizations and stretches to give you more, you're just further drilling yourself into the ground, meaning you're creating more compressive patterning on your right side. So if a person has, let's say, low back pain associated with this limited internal rotation, and you would think, let's improve the internal rotation, and they might get some relief from their back pain, what they're really doing is they're orienting their pelvis more into this internal rotation. So they're giving more space in internal rotation, which may free up the back, but they're taking mobility away from some other areas of the body. So it may be a temporary fix, but long term it might be contributing to other issues.